Hello and welcome to Newsmax Health. I'm Nick Tate. Robotic prostate surgery has been called one of the greatest advances in the war on cancer, and many health experts believe it is the wave of the future in modern medicine. By using computer-guided instruments, surgeons can be more precise in the operating room, and that leads to fewer complications and a better cure rate for patients, particularly those with aggressive forms of the disease. In recent months, however, questions have been raised about robotic surgery, and the FDA is now looking into reported problems with some doctors using the technique. But a leading authority in the field tells Newsmax Health that robotic surgery is not only safe when practiced by an experienced surgeon, but that the technique offers a dramatic improvement over conventional procedures. Dr. David Samadi, chairman of Urology and chief of Robotic Surgery at Lenox Hill Hospital in New York City, joins us today to separate fact from fiction when it comes to prostate cancer surgery. Dr. Samadi, welcome to Newsmax Health.
Thank you so much. Thank you for having me.
Dr. Samadi, what's your take on the FDA decision to look into robotic surgery? Is this a good or a bad thing?
Well, I'm glad that they're looking into this because I think we have a lot of surgeons that may be taking a weekend course and come back on Monday and pretend that they are robotic surgeons. And I always say that if you have a skilled surgeon plus the technology of robotics, that you would end up with good outcome. If you have someone who is not well trained plus technology, that's quite dangerous and you end up having a lot of complications. So when patients look for robotic surgery or surgeons, you want to choose the skilled and experienced surgeon. That's really the key message out there. You know, find out someone who is dedicated, for example, to prostate cancer, and more importantly, make sure that they're not just technicians and use the robot, but they are also good oncologists, they have good laparoscopic skills, and then use the robot as a tool to take advantage of the 3D 10 times magnification, better range of motion, and use the robot as an extension of our arms. In that sense, the outcome is superb, much better than open surgery with more precision and better outcome.
So it's really like the robotic instruments are really like a musical instrument, and the skill of the musician, and in this case, the skill and the experience of the doctor is really what's key.
Absolutely, and that's well said. So in open surgery, because there was a lot of blood in the field, we couldn't see well. So we were using our hands and tactile feedback and touch factor, but that wasn't really sensitive because we would cause a lot of damage with incontinence, with sexual dysfunction. Now in robotic surgery, because there's no blood in the field, you can actually see what you're doing, and if you can see, you don't need to touch. So in that sense, we're seeing much better, but you have to have the experience before you sit behind one of these fancy robots and be able to do it. The other thing is really who is doing the operations. Right here in New York City, there are many different hospitals with different way of doing it. We have some hospitals where the surgeon goes from room to room and is only doing part of the surgery, and I really think that that's bad medicine. The surgeon should be committed to the patient and perform the entire case from the beginning to the end, and that's what's going on at Lenox Hill. All of that, plus having the right team, the volume, and the experience, then you add the technology, and then you have the outcome you're looking for.
Okay. Well, are you worried at all that some of the reports on the FDA review are in fact giving robotic surgery an undeserved bad rap because there are a small percentage of, as you suggest, inexperienced or perhaps incompetent surgeons that are performing it?
Look, I'm glad that FDA is looking into this. They need to really look for those bad apples. Patients should really do due diligence and great research to find out who is the person that should do this kind of case, what experience. And the big question is, what if the robot breaks during the operation? Are you, as my doctor, trained in laparoscopic surgery, or can you convert to open? There's a lot of question that comes with this that they need to know, and that's what it is. But FDA should look in, and if somebody is just experimenting on the patient, they should stop that kind of practice.
Okay. Well, I know that you have done something like 4,000 of these procedures, perhaps more. Can you give us some of the details on some facts and figures, some of the numbers that you may have from your own practice on the success rates of robotic surgery? I've seen statistics that indicate, for instance, that the cure rate can be as high as 90 to 95% with some patients. Can you tell us what your practice has shown, what you have found?
Yes, so right now with urinary control, about 95 to 97% of the patients are continent. And the good thing about surgery as opposed to radiation is that as time goes on, with surgery, the patients recover and they do better and better. I only use radiation in my practice after surgery in case the cancer returns, and that's about 5 to 10%. That's when I would use radiation as a backup plan. But the urinary control is fairly good, and also the sexual function is about 80% of the patients are able to have sexual activity. We also have a lot of medications such as Viagra, Levitra, Cialis that we use in our practice to be able to make the recovery with sexual function much easier for them. The SMART technique that I have developed works really well, and this is done at Lenox Hill, where instead of removing the nerves away from the prostate or do the nerve sparing by moving the nerves to the side and then take the prostate out, where you can do some damages, I basically take the prostate away from the surrounding nerves. So leave all the nerves completely intact, leave the sphincter intact, and just remove the prostate. And that makes a lot of sense. And that's why the quality of life, as well as the prostate cancer cure, is superb.
That's one of the aspects of the precise nature of this procedure, that you can do that kind of nerve-sparing surgery. Well, you know, I wanted to get your take on PSA. PSA is in the news again this week with new research showing that, in fact, areas where PSA testing is done more frequently have a lower death rate from prostate cancer than in areas where it's not done as frequently, where things like watchful waiting, for instance, are taken more of an emphasis. I know that you are an advocate of PSA testing. I wonder if I could just get your thoughts on the new research that's out on PSA.
Thank you. I will tell you that the PSA, which stands for prostate-specific antigen, is a non-specific test. So things such as enlarged prostate, prostate cancer, inflammation of the prostate, all of that can cause an elevation of the test. So it's not a prostate cancer-specific antigen, and that's why the skill of the doctor, and it's the art of medicine to distinguish when to do the biopsy, who to operate, who you're going to watch, and who you're going to do the surgery. The interesting thing about the PSA is that we look at the velocity or the speed of it over time. So if in the course of the next 2-3 years, someone's PSA starts to double and really start to go up fast, I would be very concerned about that patient, and I would be more aggressive to do the biopsy. Now, the recent study that came out of Sweden, published in New England Journal of Medicine this week, really is phenomenal. 24 years follow-up, randomized, meaning that they put some people in watchful waiting, some men in surgery, and after 24 years, they realized that with surgery, there's a lower risk of death, lower chance of metastases, and surgery adds to the survival benefit. That's a huge news for a lot of patients that were just watching their cancers. So we're learning more and more, and you should talk to your doctor and make sure that you're not going to get into trouble. And in the hands of experienced surgeon, again, there is life after prostate cancer. There's good continence and sexual function. You just have to choose the right doctor.
Well, doctor, a lot of good information there, a lot of really good news on this very important men's health issue. Thanks for being with us today and sharing it.
Thank you so much. I appreciate it.
And thank you for joining us on Newsmax Health today.